Hi and welcome. We're so delighted to welcome Debbie Thomas, who is CEO of the Walker Center, to help us understand addiction, the hidden prevalence, and practical tips for change. Welcome, Debbie.
Thank you for having me. So I'm honored that I was asked to come and talk today because people that have addiction are important to me as a subpopulation of people that are broken and struggling in this world. And I will tell you a little bit about that shortly. But I really want you to know that we're going to spend about an hour together and we're going to learn about the prevalence of addiction. I'm going to define for you what addiction is and is not. And most importantly, I want you to learn how to talk with a loved one, a family member, a friend, a colleague, so that if someone's struggling, they might be able to start the healing process sooner than later. We're going to talk about options for treatment, medication-assisted therapy, levels of care. And at the end, I'm going to tell you about a particular model of treatment that the Walker Center has been doing that is not traditional and is showing some good outcomes. So with that, we'll just kind of get rolling. I am a licensed clinician, and I also am an addiction professional. And how did I get involved with that was 37 years ago. I cared deeply for someone. As a young woman, I thought I was in love. I knew that I cared for this person, and I had no idea that that person had an addiction. I didn't know anything about the disease of addiction. His family didn't know anything about the disease of addiction. He was bright, articulate, but something started to change. And everyone started to ignore problems that were occurring. No one knew what to do. And instead of us knowing how to address the issue and make a plan, we did nothing. And unfortunately, that person ended up dying from the disease of addiction. And we didn't even know that it was a disease because we were lacking in knowledge. So that's kind of put me on a professional career where I didn't intend to work in addiction, but it's come to me all the time when I worked in a field where highly functioning individuals, and they'd come in and say, I want to talk about this or that. There was these themes around addiction and problems. So I became an expert, and I feel that I am an expert in addiction. And I have things that I want to share with you so that you might not, in your family or friends, not know what to do. So the field of addiction is a really new field. When we think about Eastern medicine and Western medicine, Eastern medicine's been around for a long time, and we know the roots and how to help people. With the field of addiction, we have not been here for very long. And I'll give you an example, addiction treatment really started in 1937, and it's rooted in people with addiction helping other people. And most of us have heard the word Alcoholics Anonymous. We know that a particular physician who himself was an alcoholic got together with friends and said, how are we going to hold each other accountable and do things? So 1937 is when we started realizing that there were things that we could do. The principles of powerlessness, that somehow I don't have the ability to manage things. And what they did learn in these circles and rooms of Alcoholics Anonymous was that they needed each other and that they needed some sort of a restoration, which today we talk about being spirituality and a purpose and a meaning in life. So I want you to know that there's stigma around alcohol, Alcoholics Anonymous, Narcotics Anonymous, but we wouldn't have Narcotics Anonymous, Cocaine Anonymous, Overeaters Anonymous, all of these things if it wasn't something that worked. And it does work. According to the American Society of Addiction Medicine, which is the expert field for addiction medicine, they not only know that Alcoholics Anonymous work, but they endorse that Alcoholics Anonymous and the 12 steps work. And they've created a program that is called 12-step facilitation therapy because it is tried, it is true. And for more than 80 years now, we are using that as a foundation. So I want to tell you how Alcoholics Anonymous works so that it'll help you understand that I describe it as Alcoholics Anonymous and the principles are the foundation of what we now put evidence-based practice around and on top of. And if I was building a building, the concrete of the building and the foundation would be Alcoholics Anonymous. All of our evidence-based practices would be the walls and the structure. And the roof for me, as I describe it to people, are all of the extensions around people. So all of the foundational meetings, all of the family supports, all of the other professionals, that's what the roof and the foundation means. So what does Alcoholics Anonymous do? It encourages people to take a honest look at themselves. They talk about a fearless moral inventory where you really deconstruct your ego of I've got everything all together, and you rebuild yourself a little at a time. Sounds pretty simple, haha, but very, very complicated, very tedious, very emotionally draining for people because change is hard for any of us. You know, just think about, you know, times when you think, oh, what color should I paint my room? It can be like a huge project just to go to get paint samples and what you need to do. But the 12 steps is a pathway to changing positive behavior and looking at the emotional well-being of a person. You have to look at how honest you can be. And addiction causes people to lie, cheat, steal, baffle, cunning. It creates a foundation where people have to be humble and realize that they need to have 2 ears and 1 mouth. It encourages acceptance. The courage, you know, one of the things that any family member, colleague, loved one, a professional in the field, you have to be able to give people the courage to know that there's hope, the courage to know that they're not just broken, that they can forgive themselves, that the society should forgive themselves, and that with self-discipline, which is different than we'll learn around self-will, but with self-discipline and pre-planning, you can change, have this spiritual growth and awakening. And I would share that when I use the word spiritual growth and awakening, I do not mean religion. Religion is completely separate. You know, there's all kinds of religions that work wonderful different things and people choose to. But what I mean about a spiritual awakening is that you find a purpose and a meaning bigger than yourself. And that can be anything that you find it to be. And that is how you can work with a loved one or a colleague to really begin this journey of hope and healing. So what do we know right now? We know that for 80 years, people have been suffering, for more than 80 years, but we know that people have been suffering from addiction and that we've begun to know that we can help people change. We know that there's a huge stigma that people are lacking knowledge about how to professionally help and how to individually help. So one of the things that I will share is when you're looking for a professional to help your loved one, interview them in the same way that if your loved one had cancer. You know, we don't have stigma about talking about cancer, and I will tediously find the expert. I will drive places, I will screen people and say, how much schooling and how much board certification and how many cases have you worked with? The same thing needs to happen if you're trying to have a loved one that is having an issue. Don't go to a generalist. I'm a mental health counselor as well as an addictionologist, an addiction professional, but go to the person that understands addiction. Don't just go to somebody that says, I work with everyone, because you need the expertise. This is an emotional issue, it's a physical issue, it's a brain chemistry issue. So we're gonna spend the next 45 minutes now really learning how you're going to go about busting the stigma of addiction and not believing that people are bad and have a lack of willpower. And we're going to go right into what we do know, all the way to the point where you're going to have some skills to what to say, how to say. because we're not talking about a small portion of our population that has addiction. This is a pandemic, and it is not going away, unfortunately. So the prevalence of addiction. Statistics come out a little bit behind, but for 2018, we had 31.9 million Americans. That's 11.7% of the population over the age of 12 that were using illegal drugs. That's a lot of people, illegal drugs. I don't want to just stop there. I want to say that the illegal drugs that they're using is a wide variety. You can see that marijuana and prescription drugs fall right up there in the top numbers of percentages. Our opiate pandemic that we're talking about fits right into there. We'll hear all the time about heroin being a huge problem. We'll talk about methamphetamines. But what I want everyone to know is that addiction is not drug specific. We track data drug specific. We fund treatment drug specific. You know, the state that I live in, we have money attached to alcohol use. We have money attached to opiate use. We have money for prescription drug problems. But addiction does not care what substance somebody uses. And addiction will cross-addict very quickly. So, you know, talking with one of our clients yesterday, yes, their drug of choice was heroin, but when they can't find their heroin or they get too down and depressed, they use methamphetamines to increase their ability to function in the world. And we know when people can't get their prescription drugs anymore, they will go to the street and buy something. So the point that I want you to know is addiction does not care of the substance. I want to then throw in the fact that if we put alcohol, which is a legal substance for people over the age of 21, if we put alcohol and tobacco into the numbers of people that are suffering with addiction, that number jumps to over 60% of the American people that are addicted. So if you look at your colleagues, 1 in 2 people are struggling with something, whether that's nicotine, alcohol, or an illegal drug. Just a little different graphic because we all learn in different ways that the number of people in the United States that are using illegal drugs, you can see that the large amount is marijuana. And we're going to talk a little bit about marijuana because it has its own stigma. It has a lot of lack of knowledge that associate with people. We have medical marijuana, we have recreational marijuana, we have synthetic marijuana, and it'll be important that I give you some knowledge to empower yourself so that you'll know when you're talking to someone what that trouble or struggle for them may be. But cocaine, marijuana, heroin, methamphetamine, every substance causes someone a problem. And that's the lack of agency for people. So I want to tell you a little bit about marijuana and the concentrates. Marijuana is not just a joint anymore. I'm going to age myself and say that I am feeling older all the time. And marijuana used to be one strain of marijuana. It used to be indica. And it was the things that are portrayed in the movies. It's the lazy high, gives me the munchies, I sleep, I don't bother anybody. It is a central nervous system depressant. That's the one that people try and say it's not going to hurt anybody, it's just leave people alone to their own autonomy. I'm not going to give any judgments on what people's choices are, but I am going to educate you that that's only a very small portion of today's marijuana. The second strain of marijuana that comes from the sativa aspect of marijuana works more as a stimulant. It gives people a high that is a higher high. It has a lot of extreme energy, kind of the way methamphetamines does, and it has a hallucinogenic effect. So you can imagine if our younger people that don't have fully formed brains are using this strain of marijuana, it looks a whole lot different. It's a lot more dangerous and can cause significant problems. The last type of marijuana that I want you to know about is a hybrid, where this is the customized designer marijuana, where you get to go into apothecaries or go into the dark web and order things that are customized. It says, you know, I'd like to have an initial high energy sativa kind of effect, and then I'd like it to kind of mellow me out. And they will create designer hybrid versions. Um, and, you know, enough said about that. What I want you to know is traditional marijuana, in that I'm mellowed out kind of approach, that would have 5 to 20% of the THC. So the active ingredient that causes the high, you would have between 5 and 20%. Now compare that to medical marijuana. Medical marijuana has about 3 to 5% THC. And we know that medical marijuana has a purpose for some people in some ways. And again, I'm not saying, I'm not going to try and convince anyone around whether you should or should not believe in medical marijuana. So I just want to put that into giving you facts, not opinions. The concentrates of what we do now with marijuana now is not, most people are not smoking traditional marijuana at 5 to 20%. Most people now are creating designer marijuana, and they're using it in some concentrated different way. The concentrates have lots of different names. There's oils that have 30 to 50% of that THC. There's waxes that are very much more concentrated that have 40 to 60% THC, all the way up to a product that is called shatter, and that can have greater than 75% THC. One hit of marijuana for those higher grades is about the size of a pinpoint, of a top of a pinpoint. Much different than the way some of our media portrays, you know, I'm going to roll up a big joint or doobie that's as big as my thumb or looks like a cigar, and I'm going to have a mellow high. We now have a much different approach. We have enhanced paranoia and hallucinations, and people that are having psychotic breaks and high blood pressure that we've never seen before. So I want you to know that when somebody's like, oh, I'm just smoking a little pot, I'm just smoking a little weed, that you need to be aware that when you want to help a friend or a loved one, you need to empower yourself to know what exactly they're talking about when they say, I'm just using marijuana. The next drug prevalence that I want you to know about is kratom. Kratom is currently not on the DEA's schedule for what is legal or not legal, or controlled or not controlled. It is a natural alternative to prescription drugs. That's the way it's marketed. It's an herb from a tree in Asia, and people report that they use it to not have to use opiates, for example, or the painkillers. However, the people that are starting to use kratom will begin to describe addictive principles. They will say, wait a minute, I am going through withdrawals that I'm not using it. I am needing to use higher quantities and more than I wanted to. In low doses, the kratom will give people a stimulant kind of effect, and they have to use higher doses to get that opioid pain relief kind of effect. The kratom is going to be coming in all kinds of different things. It can be a liquid that you put in, make a tea. It can be bulk bins of powder that you add to things. It can come in a capsule form where you're swallowing a quantity. The challenge is that there are 40 different strains right now in the United States that are not DEA regulated at all. And so you do not know what you're taking when you go into an apothecary or a herbal shop or a health and wellness center. You're going to see this big panel of things that the DEA has not regulated. In 2016, the DEA intended to put kratom on the Schedule 1 substance list, which would mean that they would start to monitor it. Unfortunately, the challenge is that they couldn't determine what the substance was that they would regulate because it was so many different substances. It's currently illegal in any format that the States want to try and figure it out, but only 6 states, as you can see, have been able to say that kratom is illegal. In my state of Idaho currently, we have, in February of this year, legislation came on board that kratom was going to be regulated. That's currently pending. But Washington and Oregon, our other closest states, kratom is still legal. And when people say they're using kratom, they are using something that they don't really know what it is. It's just a guess. The reason I'm sharing this all is to empower you and to let you know later when we talk about the brain and the brain chemistry and what happens in the brain, that it's not the substance that's causing the problem. It's the fact that we're harming our brain and damaging our brain. So I want to switch gears just a little bit and talk with you about how the field of addiction is growing. And one of the reasons that we know it's growing is that the Centers for Medicaid and Medicare, which is a very tightly regulated aspect of our government, they realize that addiction is a problem, and they put their money where they saw advancements. So Medicaid, for the first time in January of this year, 2020, started to pay for opioid treatment programs. So they began to pay for medication-assisted therapy, and that was huge because that demonstrates that they know that our field is advancing and that we need to treat addiction in the same way that we would say, oh yes, we're going to pay for insulin for a diabetic, or we know why a cardiac patient needs to go to cardiac rehab and have a good dietitian. So Medicaid expansion in our country across the majority of our states has helped people get health care that they didn't have. And this year, we now have opportunities to do medication-assisted therapy. So now I want to talk to you about, what is addiction and what is not addiction. Addiction is not caused by a lack of willpower. Addiction is caused by a change in your brain, in the person that's using brain, and it's an altering of our reward system. The back of our brain is the place that, when you are in a coma, your brain stem says, breathe, don't breathe, and keeps us alive. The frontal cortex of our brain is the part that gives us higher decision-making and reasoning, and, we're able to do the things that we need to do. But the internal parts of our brain, the parts that are here in the midsection of our brain, are really designed by all these neurotransmitter pathways. And dopamine is one of the rewards pathways. Dopamine teaches us and our brain to say, I am rewarded and motivated by something. One of the most powerful things is eating. If you're hungry and you start to get tired and you eat something, your brain gives you a dopamine and it says, oh, this works for me. I know that eating does a certain thing. Many of us know if I eat sugar or chocolate, it gives me pleasure and reward. It gives me energy. I can function better with my motor functioning. I can sit taller. I can walk more. I can stay awake. And that's that dopamine pathway that is rewarding something like eating. We also know that we talk a lot about sex addiction, but it's taking it away from sex addiction. Just as human beings, the other part of the dopamine reward system helps us with procreation. Why do we get attracted to somebody and want to mate with them is no different than other species. There's a reward system. It feels good. I get rewarded by wanting to raise these children and et cetera. And that is a working dopamine side of your brain saying, I'm motivated, I get some pleasure out of something, I'm going to function in a certain way, and it's going to help me. On the other side of the brain, we have the serotonin pathways and norepinephrine and oxytocin. All of the other side is the part that regulates our mood. It says, oh, I'm a mother and I want to sit with this beautiful brand new baby that I have, and I feel good and I get calm. Um, my memory processing works out of the serotonin side of my brain. Our sleep patterns are regulated out of the serotonin side of our brain. Our cognition, how well I think, works out of the serotonin side of our brain. Um, so addiction hijacks the brain, changes our brain chemistry, and instead of having positive things happening, negative things start to happen. So what exactly happens in a negative system of the brain? What happens is the messengers in the brain, instead of it rewarding you in a positive way, it starts to reward you in a negative way. And your brain gets hijacked because your brain gets rewarded in an anticipatory way. I will use food. Sometimes we will say, I'm really hungry and I know I need to eat something healthy, protein and a vegetable. It's a little boring, but I feel better in the long run because I did that. There's other times that we get anticipatory hunger where we're like, ooh, grandma's making a great chocolate cake, or I can smell the pizza that my friend or driving by your specialty pizza shop. And our brain gets an anticipation of, ooh, if I eat this, it's going to spark both the mood pleasure side of my brain, and I'm going to feed my brain and be able to process that it's healthy food. What happens with addiction when you put chemicals in your brain like cocaine, like amphetamines, like marijuana, is your brain gets hijacked. Your brain starts to anticipate that I know that this is going to change my mood, my memory, my thinking, my feeling, and it made me feel good. I had a reward. And so the only thing the brain's trying to chase is, I want to feel good. I know this made me feel good. And we create those furrows in our pathways that we end up not doing positive things. So many of us have heard chasing the high. There's movies and media around I'm chasing the high, because the brain always remembers in those neural pathways how it felt the first time you did something. So think back to that first, I'm in love, I kissed the first person, you know how it felt. Your brain remembers that. Your brain remembers the first time you had alcohol, whether it was a positive or negative experience, it remembers that warm feeling. If you drank all the way to intoxication, it remembers that. And what happens is your brain wants that positive pleasure. So all the chemicals do different things. You need more to get high. You need less consequences, but your brain doesn't realize that it has consequences in memory processing, or that you got into a fight with your loved one because you were high. It just remembers it wants to get high. This is what leads all of us to believe that it's a stigma around willpower, because logically we would say something you did caused you to have pain, so don't do it anymore. Just stop. Just stop. If I was a little baby and I touched a hot burner, I'd go, ooh, that's hot, and I wouldn't want to touch the burner again. Most of us remember that. But we also know that we don't just stop. We sometimes still touch things. And that's what leads us to realize that willpower is not what causes addiction. Addiction is caused by a change in the brain chemistry where your brain is hijacked, and you then have to keep doing something to get the same result over and over. So when someone develops an addiction, we know that their judgment and reasoning is clouded, because no one would wake up in the morning. I run an addiction treatment center with 50 beds in it, and I have the opportunity to have lunch with our clients in early, middle, and late stages of their treatment. And no one comes in saying, I want to be a drug addict. I want to ruin my life, lose my job, have my health impaired. What they do come in and say is, my emotions were hurting. I didn't mean for this to happen. And my emotions became really unpredictable, but I started chasing the high. I used so that I could feel normal again. I used because I no longer was having all these pleasurable things on the dopamine side of my brain. I was chasing, trying to avoid all the negative things that were going on. But we don't give the compassion to people. What we say is, you should have just stopped. You should have known better. And people didn't know better, just like we didn't know when we were little not to touch the stove. So approaching someone about a really personal subject, like why did you start doing this, is not always the best way to start. When someone develops an addiction, their world revolves around using, they're constantly wanting to feel normal, and we have to give a little bit of compassion for that. So how does that person, how do we go from just one or two little things to our whole world being out of control? I want to teach you about something called tolerance. Tolerance is when our body needs to use more just to have the same effect. So in the same way that sleeping pills, if you use one sleeping pill, it'll give you a certain thing. But we know people that'll use sleeping pills and then they need to use a little bit more and a little bit more. In the same way that if I had knee surgery and the doctor says you need to ice, elevate, and use this pain medicine, if I don't sit down, ice, and elevate, and I use the pain pills, I'm going to need more pain pills to get my relief. And if I don't do everything else that the doctor's telling me, I'm going to have no choice but to use two times a day. Then I'm going to need to use three times a day just to get the same pain relief as I did when I was wanting my pain relief. So tolerance just is a physiological aspect in our body where you need more to get the same effect. Tolerance is not the same as dependence. Dependence is when you cannot stop using something without having a physical withdrawal aspect. So people are really worried about opiate and pain pills. If you go to the doctor, have knee surgery, you will have withdrawal from that medicine. Typically, you don't even realize it because you haven't been on it for a long time, but your body will withdraw. You will have some mild symptoms. You realize that due to that imbalance in your body. Dependence, however, is when you stop using and you go into a physical and emotional withdrawal pattern. And you need to realize that you need more to do it. Dependence itself and withdrawal is not addiction. Those are just physiological things that happen. Addiction is in combination with the emotional and the brain hijacking process that happens. So I want to start with what is drug abuse. Drug abuse, and we use these terms interchangeably all the time, like, oh, you're a drug addict, you're a drug abuser, you're dependent on drugs. I just want you to know that drug abuse is any incorrect use of any substance. It doesn't matter whether it is using a prescribed drug in an overusing it. So if it says to use three ibuprofen or whatever a day, and I decide to eat 6 of them, that meets the definition of drug abuse because I'm using more than was written on the label. Drug abuse is any use of illegal substances. It is also the incorrect use of a substance that was prescribed to you. Not good or bad, right or wrong. I want you to know the definition so that I can help you understand what is addiction. Addiction is that your brain has been hijacked and you now have the inability to stop. If I right now ask you to hold your breath, most of us would hold our breath for somewhere between 45 seconds and a minute. There's going to be that one overachiever athlete that can do it for 2 minutes. But most of us, we can't just stop breathing. It is a part of our body and our brain that we have to do. Addiction is the same way. You have truly lost your ability to control your brain. You've lost the agency over how your brain would have normally worked, and you begin to lose important things like your ability to make good decisions. You lose your jobs, your family, because you are starting to have things like tolerance, dependency, and abuse. It can lead to legal things, but addiction does not equal legal actions. There's many people that are addicted and come to treatment that never ever have broke the law and gotten themselves into legal problems. But we do associate addiction with, oh, you got arrested, you got into some trouble. So addiction is a neurotransmitter that has gotten broken. We have these chemical reward processes and very similar things. We're talking about drugs and alcohol today, but very similar things happen for people in other behavioral addictions, whether it's eating disorders, gambling, pornography, sex. The brain starts to work differently, and we can't just stop. Oops, I'm going to back up one. We can't just stop. So now I want to move into, how would you talk to someone about addiction? I hope you understand that 50% of us are doing things that are considered addiction. Our brain has been damaged, and brain chemistry change is what causes addiction. And why would we need to talk to people? We need to talk to people because we can help them heal. We can help them grow. Our first instinct, though, is to not rock the boat. I don't want to talk to you about your problem, because one of two things is going to happen. You might point your fingers back at me and say, well, you've got your own problems. Why are you talking to me? You most likely are going to get angry or defensive and say, get out of my business. It's not as much of a problem as you think it is. And as a compassionate, loving person, you don't want to make things worse, and having conversations can sometimes make things worse. So we don't want other people's judgmentalism. We don't want to tell people to just stop doing their bad behavior, because when I point at you, I've got 4 fingers pointing back at myself. We don't want to tell people that I know better than they do. Because one of the things that I know is, after 30 some years of working with people, is the individual really knows themselves the very best, and that we need to have conversations that aren't threatening and intimidating and show compassion and empathy. Because our world and our society and our media is not compassionate to people. We have half of our media that's saying, it's not a big deal, let's legalize everything. All the subtle things that are on movies and t-shirts, and we're just teaching people that it's okay. And yet we also have this other side that is so judgmental that you're bad if you have a problem. So when you want to talk to somebody, what I would share with you is, have compassion and begin to time your conversation. When it's time to talk to somebody, absolutely do not talk to the person when they're under the influence. Their brain is hijacked, their brain is under the influence, and it's not going to go anywhere. Whatever your fear is, it'll come right back at you. So do not talk to people when they're under the influence. We also need to make sure that we don't talk to people when they are immediately coming out of a bad situation. The morning after they got arrested for their DUI and they feel so ashamed, they're not going to be able to listen to your caring and compassion. The only choice for human survival would be to defend and make themselves protected. Don't talk to the person in the middle of a hangover. You're like, okay, I'm going to talk to them later in the next day when their head is pounding. Just realize, how do you want to be talked to? And what's the right timing? Maybe you've tried to talk to a friend about, it doesn't matter what. You invite them to a nice environment, like, hey, can we have lunch together? Let me buy lunch. Is it a good time? Do you have your kids taken care of? Or any of those nice, kind things. The same thing needs to happen when you're talking to a loved one or a friend when you're worried about them. Over killing people with kindness is not a bad thing, as long as you know that you are not going to be rescuing them from their consequence. You need to share your hopefulness. Share that you care about them, you love them, whatever the right words are for you, no matter what, but be very specific about the concern. So it could sound something like, I am very concerned that you were recently drinking and driving. I saw that your kids were in the car with you. I know how much you love your children, and I know you'd never, ever be able to forgive yourself if something happened to them. And what my hopefulness for you is that together we can talk about how you would never put your children at risk like that again. Um, so that it doesn't sound like, you terrible mother, you put your kids in the car and you didn't even strap them into their car seats and you got arrested for a DUI and your kids should be taken away from you and put into care of a loved one or the system. That's how you wouldn't want to talk versus, I'm concerned about a behavior. I'm not going to judge you, but I am going to share with you my concern. The other thing that when you go into this type of a healthy conversation is to realize, what is your role? You know, if you are trying to talk to your mother and you are considered by her to be the troubled, whiny child, you might not be the right one to talk to your mother about what your concerns are. But if you're a trusted colleague and you work together on a great project and a team together, and you invite somebody and say, hey, you know, the fact that you've been telling me about how you're smoking a lot of pot and you're starting to use some dab and you can't really think straight anymore, and you want me to cover for you at work and do your work so our team can look good, you might be exactly the loved one or the trusted colleague that can talk to them. So know your limits on when you're going to talk to somebody, what role you're going to talk to them in. And before you start into a conversation, have a little conversation with yourself about what is it that you're going to tolerate and what's your role. So maybe if this is a family member, you might say that your limit is that I will call the police if X, Y, or Z happens. You know, if you bring alcohol or drugs into my home, I will ask you not to be here anymore. If you are saying that you want to buy groceries and you don't have enough food, I will not give you a $50 bill, but I will go to the grocery store and bring you a gallon of milk. So know what limits you want to set for yourself before you start talking to the person. The other thing when you start to have this trusted conversation and you want to change things is know what professional help you would want to give. You are not the professional. So research the resources first. You know where there's a place to get an assessment. Research if there's funding options. That's one of the hardest things for people to navigate is, I'd like for you to get help, but I can't pay for that. Know if there's state funding, know if there's insurance opportunities, have any of that worked out before you start to talk to the person. And then the final conversation might sound like, Debbie, I'm really worried about you. You have been doing this. You've shown some irresponsible behaviors and give an example of that, and say, I'm not going to try and talk you into whether you have a problem or not. But what I do know is this really great professional that you can have a conversation with, and I've already checked out the funding and it is available for $20. Or you and I both have the same insurance because we work for the same company, and I know that you can go and talk to our employee assistance program. Have the resources so that you're not just wagging your finger saying you're bad and I want you to stop and dropping them on their head. The next thing I want you to know is you need to be ready for their reaction. People are not going to go, yippee yahoo, thank you for sharing with me that my life is a mess and I'm broken. They are going to be defensive. There's going to be denial of, oh, you just saw me the one time at my worst. I'm really not that bad. I've got it okay. They might accuse others or blame others. They might blame systems and want to get you to just back off a little bit. Realize that that's okay. You know, that's when the kindness and the compassion of it's okay. Um, Sometimes the person that's using it in their life has gotten out of control. They need to, for survival, believe that they're invincible, believe that this isn't going to be a problem, because in the darkest moments, they realize that life is out of control. Most of the people that I know, once they got clean and sober, they say, I know my brain was not working right. My brain was hijacked, and I was scared to death to admit it to myself because I didn't know how to get help. So realize that you're going to have to be somebody that comes alongside the person and gives them the opportunity to have a help. So I'll break it down into a really last things. Offer the first steps of hope. Offer that you can tell them that they're not a waste of time. You can forgive them for things that are not happening well in their life, and just give them that hopefulness. When they're reaching out, agree that you will not tolerate any really dangerous things, but you are going to bring them some options and some treatment ideas that they can do. Suggest that they start by just having a conversation with other people, and that it's okay that you have their best interest at heart. The other thing to do is learn options about treatment. If we as a society truly believe that addiction was a disease, we would know that we need a full continuum of care, that not everybody needs to be locked up in jail. Not everybody needs to go to a big residential center and have addiction treatment for 30 days or 60 days. We wouldn't want people just going to emergency rooms and being treated for one day and treated with no treatment. We would know that there's a full continuum of care. And I will tell you that the American Society of Addiction Medicine has levels of care that we have learned are fluid. It goes all the way from a 0 level of care, meaning you don't need any care, all the way up to a level 5. And I'll go quickly and share that 0.5 is early intervention. You know, you need some knowledge. You might need a course called like a DUI course. Some people might need intensive outpatient or partial, where they're living in their own home and they go to care. Other people might need residential. Some people might need to go to a hospital because they have damaged their bodies and they need IVs and they need medical intervention. But the goal is to get the right dosage of care for the least amount of time in the least restricted environment, so that people can recover in their communities, in their homes, with the people that they're going to be living life with. So I want to tell you, to end this, that Walker Center has 47 years of experience. We're a level 3.5 and 3.7. So we have people living in the 4 walls doing medical managed withdrawal management with doctors and nurses. And instead of just having them come in for a little dose of treatment and go out and drop them on their head and say, good luck, we started last year with an opportunity with the state of Idaho and some funds from our federal government, a project that's called the Hope Project. It is a capitated model. Instead of people having to pay insurance deductibles and co-pays, they get to come in as one lump sum fee, and they get to be followed for an entire year of care. They get to have continuity with a social worker who follows them out into their living environment, helps them with withdrawal management, medication-assisted therapy, helps through the ongoing life of what's the trauma that is happening, what are the triggers that are happening. And I would look to have you understand in your particular community what creative things are happening. Do you have crisis centers and recovery centers? And learn about that. because in my little community, we took our addictionologist who's specializes in the brain and what happens. We partnered with our local North Canyon Medical Center, and we created this wonderful care team approach where friends, family, the community, the churches, the state government, the local county government, we put together something that follows people for a year, and people restore themselves to life and to a meaningful purpose so that their brain can heal, they can get back the reward pathways in their life and have joy. So I want you to know that my contact information is here, and that you can see the resources to reach out and follow up with care and questions. And I will be more than happy to answer questions and point you in the right direction.
That was so great, Debbie. Thank you so much for, it was really, really terrific. And I actually, before we take everybody else's questions, I have 2 questions of my own. So I just want to get in here as people get ready to ask their questions too. So one of the things I think I heard from you is that 50% of people are addicted, or 50% of people are addicted to drugs, or what was that 50%?
Yeah, so if you put alcohol, illegal drugs, and all the behavioral health addictions together, you would have over 60% of people are addicted to something. If you take out alcohol, then you're going to be right around the 50% mark. So
So 50% of people are not addicted to alcohol and drugs. Okay.
It is not true. You'll hear people say 50% of the people are addicted to alcohol and drugs. That is not true.
Okay. I just wanted to clarify that. Yeah.
Yes, more than 50% of the people, if you put in all behavioral health addictions, and it's right around 38 to 40% of the people that are addicted to drugs and alcohol.
Mm-hmm. Now I have another question, which is especially in our younger people, especially in, like in the early 20s, when a lot of kids experiment with things. What is the connection between experimenting with drugs and like mental illness, like schizophrenia or other can you address that at all?
Absolutely. There's a huge correlation between earlier use and damaging your brain. So addiction is the hijacking of the brain pathways. Our brains as a human being fully form somewhere between the ages of around 23 to 26. So women's brains do truly form a little bit sooner than men. And if you wanted to completely protect your brain, you would want to use no substances. You wouldn't want to put any alcohol, tobacco, marijuana, anything in your brain until that 23 to 25 or 6 years, because that's when your brain pathways are completely formed. When you put chemicals in sooner, so when we have 13, 14, 15-year-olds experimenting, there is a direct correlation to the triggering of schizophrenia, for example, and a mental illness. If it was predisposed, it's going to come out sooner. And yeah, it's a danger. If I was a parent or an educator, if you can tell anybody anything, it's like, I don't want to judge what you do, but if you can do one thing, don't put any substance in your body until your brain is fully formed.
But so let's just say somebody, if the kid has damaged their brain, then how do you I loved your examples of language to use with people who are addicted. And as a parent, I mean, that's always been my biggest fear for sure. So I'm sure there are a lot of people listening to this who are parents. What if you suspect that your, young adult child actually is suffering mental illness? Is there a script or a way to help them get help if their brain's not functioning? Like, how do you navigate that?
Absolutely. So I think the one thing is to not be angry at your child or your loved one. So sharing compassion when somebody, young people know, like young people have this dichotomy. We're supposed to be individuating and we're supposed to be growing into our own right, full independence. But young people really do know that they are not making good choices. And if you can give that independence and autonomy a voice in your conversation, then you're going to be more likely to have a conversation. So it'll end up sounding like, hey, I'm not trying to control your entire life. My goal is for you to grow up, leave my nest, my home, my control, and for you to make the best decisions and have the best life that you want. And it would look like, oh, you would like to be a skateboarder, or you want to be an IT computer programmer. Here's where I would be concerned that you're not going to reach your goal if you are smoking pot and not going to school. Most computer programmers have to know math, and most computer programmers have a bachelor's degree, for example. And so you'd have a conversation that gives them autonomy, but puts structure around it.
Yeah, thank you. That's really great. So for the folks that are on, if you have any questions, you can pop in here. Anybody have questions they want to ask? Yeah, Nancy. I'll unmute you. Go ahead. You're unmuted. Yeah.
Thank you.
Yeah.
Hi, Nancy.
Hi. First of all, thank you. I was actually a drug and alcohol counselor for 15 years. I'm still amazed with the stigma that with it and how little people know. I was so disappointed in that. I agree. I think so many people could be helped if, that was overcome somehow. I also find it interesting that in my experience, oftentimes when, the 12-step model is or was recommended, it usually came with like such a heavy sigh or it was like this huge thing. And I always found it interesting because when you really look at it, I mean, I personally just think it's such a healthy model that probably most people would benefit by following. It's a way of life. Anyhow, having said all that, I have a client who he does not have any medical problems, did become quadriplegic about 5 years ago. And since that time has struggled with sleep. So that person's been using marijuana, which is now legal here in California, but has been doing like it's one of the oils in reports that he takes one hit every night. That's all he needs to just get him past that point. But it's never changed. He's never, during the last like 3 years, he's never needed more. That's it. That one time, go to sleep, and during the day, he's doing stuff. I mean, he's working and what have you. Long-term effects from doing that, if you're not increasing and you're just, it's something that you use to fall asleep, which by the way, now that it's legal, I hear more and more people do.
Mm-hmm. Well, that's a good question.
Yeah, so, it's an individual choice, in the scenario that you described, it doesn't sound like there's probably not much negative consequences for him. We do know that substances change sleep patterns. So the fact that he hasn't increased the use is a positive thing, because the other things that do happen is people are like, oh, I only need a little bit, but they're oftentimes not getting restful sleep or moving into REM sleep. But that's something that he would need to talk to his healthcare professional about, because, addiction is the adverse consequences. Dependence is having to do something over and over. I can just say that, you've hit on a topic that is a challenge. It's not the typical way. Most people are using multiple times a day, multiple things. So, and chemicals do change your sleep pattern. including the sleep pills that people do.
Yeah, yeah. And I know we're right at time. So what I'd like to do is, first of all, thank you, Debbie. I'm making your contact information a little bit bigger on the screen.
Okay.
And I'm assuming that you'll be able to respond as people. If you are viewing this in the Wahova app, you can also send a message to Debbie and she will get it into her email and be able to respond to you. So just know that that will happen. Thank you so much. This was absolutely fantastic today. I learned a lot and it was really, really good.
You're welcome. It's my pleasure. Thank you for having me.